in India, breaking world records for the past 4 days in a row. The country reported nearly 350,000 cases and more than 2,700 deaths on Sunday. Life-saving oxygen is in short supply. Hospitals across the country are running out of beds. Crematoriums are at their limits. CGTN's Timothy Ulrich has more, but a warning first, you may find some of these pictures disturbing.
Cars line up outside a Sikh temple in Delhi for free oxygen. What was a place of sanctuary is now a last line of defense for patients suffering from severe symptoms.
We are trying to save the life of all these people who are disagreed, and their all relatives are not accepted by hospitals, from government hospitals also and private hospitals, denied to admit them. Those patients are coming to this Gurdwara, and we are trying to save their life.
Oxygen has been in short supply amid the country's latest surge. It sent India scrambling to search for more. Elsewhere, another shortage, places to cremate bodies. It's meant leaving the pyres burning full-time and constructing more.
A lot of bodies are coming. There's no space inside the crematorium. There were 34 cremators, but still we had to make 20 more platforms to meet needs.
Vaccines have also been in short supply, a problem challenging the rollout of doses in a country known as the world's pharmacy. Several nations have pledged aid for India over the past week. The latest, the U.S., which said Sunday it will partially lift a ban on the export of raw materials needed in the manufacturing of vaccines, as well as sending equipment. Health experts are questioning how India has been so underprepared for this wave. A nationwide lockdown was first ordered over a year ago, and the country had since been struggling under a steady rise in cases. Prime Minister Narendra Modi is facing criticism for letting India drop its guard. On Sunday, he said the country is facing a serious problem.
We were confident. Our spirits were up after successfully tackling the first wave of COVID-19, but this storm has shaken the nation.
The question is, what steps will the government take in response? Lockdown measures have been put in place in several parts of India. Delhi on Sunday extended restrictions for another week. But what, if anything, can be done to address the issues the country faces that has left many gasping for breath? Timothy Ulrich, CGTN.
So for the latest on the ground in India, let's get over to our reporter Ravindra Bala. She's live for us in Delhi. Ravindra, the scenes there are absolutely heartbreaking. Several countries now, including the U.S., Britain, France, Germany, stepping up and offering help. How much of an impact is that going to make?
Of course, it is going to be a good help in the sense that since there are shortages of oxygen cylinders, ventilators, so as UK is going to fly in some of this medical equipment by Tuesday, it will definitely be brought now by railways instead of by road. So that is, decreasing the time of reaching that oxygen to the hospitals, which will the impact of which we will see in a few days. But definitely the support which is coming from across the world has been welcomed in India. Only that the US has not still opened, lifted their ban on supplying the raw materials for making the vaccines. That's something which India is still negotiating, but definitely the kind of help from various parts of the world, including their strange neighbor Pakistan, has been welcomed by India. Jonathan.
And Ravindra, we heard the Prime Minister say the second wave has shaken the nation like a storm, yet about a week ago, he told local governments to try to avoid harsh restrictions and use lockdowns as a last resort. So are we seeing a shift in messaging and policy, perhaps, from the Prime Minister?
Well, as I was telling you, Jonathan, the situation is such that it's a challenge between lives and livelihoods. For the government to actually decide on a lockdown, that means there will be a big hit to the economy, which we saw it was last year, and that is the risk no government is going to take. So now the central government has put the onus on the state governments, and what we are seeing is local restrictions which are being put by the state governments. Like for instance, Delhi has put 1 more week. They've extended the lockdown by 1 more week, and that actually impacts the economy, which of course will have a major impact on the livelihoods of people, because in India millions are working as daily earners, they are working as migrant laborers, and we've seen how there was an exodus of migrant workers last year and again this year, like for Delhi, Mumbai, and other cities. The moment lockdowns were announced, there were trains to take these people back home to their villages because they did not want to be stranded. So that's the challenge, and that's why we hear this kind of a change in policy. Even if we look at the Chief Minister of Delhi, initially he said there will be no lockdown. He's not in favor of the lockdowns, but there is no choice. Looking at the crumbling health infrastructure, it is important to break the chain of the virus, and that's what exactly the governments are now doing. Rather than having a micro containment zone, they have to have a total lockdown to break the chain with the kind of infection that we are seeing, the high infectivity rates. Jonathan.
Indeed, the suffering there just seems so overwhelming. Okay, Ravana Baba, live for us in Delhi. Thank you.